Microbiology in Endodontics. In 1894, Miller said that the bacteria are a causative agent of apical periodontitis. But there are different types of irritants that may cause apical periodontitis. These irritants irritate the pulp, causing various degree of pulp and periapical inflammation. More than 400 different microbial species has been found in the infected root canals, usually in combinations, but fungus has been sometimes found in the infected root canal. Change in the composition of the microbiota is due to change in environmental condition, especially oxygen tension and nutrient availability. In the very initial phases of pulp infection, facultative bacteria predominate. After a few days or weeks, oxygen decreases within the root canal as the result of pulp necrosis and consumption by facultative bacteria. Oxygen supply is affected with a loss of blood circulation in the necrotic pulp will develop an obligate microbiota. Nutrition of bacteria. The main source of nutrient for the bacteria colonizing the root canal system include number 1, necrotic pulp tissue, number 2, proteins and glycoproteins from tissue fluid and oxidate that seep into the root canal system via apical and lateral foramens. Number 3, component of the saliva that penetrate coronally into the root canal. Number 4, the protects of the metabolism of other bacteria. Pulpal pathways. Bacteria usually from dental caries is the main source of entry to the pulp and periradicular tissue, and they enter either directly or through dentinal tubules. Modes of entry for bacteria to the pulp are as follows. Number 1, through the carious cavity. Number 2, through the dentinal tubules as in contamination during cavity preparation, through exposed root surface and surface with erosion, abrasion, and attrition. Number 3, through the apical foramen as in advanced periodontitis, where a microorganism reach the apical foramen and they enter the pulp. Number 4, through the bloodstream following a trauma or inflammation to the pulp. Any bacteria in the blood may be attracted to the pulp, causing pulpitis. Number 5, through faulty tooth restoration. Number 6, through extension of periapical infection from adjacent infected tooth. Host-parasite interaction. This interaction depends on number 1, microbial virulence factor. These are microbial proteins, structural components, or strategies like biofilm formation in the microorganism that give it capability to cause tissue damage. The ability of the microorganism to cause disease is regarded as pathogenicity. Virulence indicates the degree of pathogenicity of microorganism. Some microorganisms cause disease in the host are called primary pathogens, while other microorganisms cause disease only when the host defenses are decreased, which are called opportunistic pathogens. Microbial proteins as endotoxin enzyme, metabolic endoproteins affect the microbial virulence. Number 2, host-resistant factors. The reaction of the host to the presence of bacteria or their protect can be affected by different factors like A, platelet factors, B. Serum factors as antibodies IgG, IgM. Number C. Lymphocytic factor as lysosomes, which hydrolyzes bacterial cell wall of gram-positive bacteria. D. Macrophage factors E. Lymphocytic factor as lymphotoxin and macrophage activating factor. Now, F. Salivary factor as lysosomes, antibodies, IgA. Biofilm and bacterial interactions. The community forming ability is essential for microbial survival in all environments. Most of the microorganisms in nature grow and function as members of metabolically integrated communities called the biofilm. The biofilm can be defined as multicellular microbial community embedded by cells that are firmly attached to the surface and enmeshed in the self-produced matrix of extracellular polymeric substance, usually polysaccharide. The ability to form biofilm is regarded as a virulence factor, and biofilm infection account for an estimated 65% to 80% of bacterial infections. Biofilm are structurally and dynamically organized complex biological systems. Bacterial cells in the biofilm form microcolonies plus minus 15% by volume that are embedded and randomly distributed in the extracellular polymeric matrix plus minus 85% by volume and separated by water channels. The matrix is not only important physically as a part of the scaffold that determines the biofilm structure, but it also biologically active and can retain nutrients, water, and essential enzyme within the biofilm. The matrix can also protect the biofilm community from external danger and may participate in adherence to the surface. Spread of the bacteria in the body. Number 1. Bacteremia. Bacteria, especially alpha hemolytic streptococcus, can enter the bloodstream during routine dental treatment. In normal person, the bacteria are killed within 10 minutes by the body defense mechanism. Infective endocarditis happens in the bacteremia to the patients with a history of rheumatic fever, with cardiac murmur or mitral valve prolapse. Number 2. Septicemia. It is a serious life-threatening bacteria or their products invasion of the bloodstream. It happens when body defense is low or when the infection overwhelming. It is associated with severe signs and symptoms. Number 3. Cellulitis. It is an acute infection of the alveolar bone and loose connective tissue, and it is diffused spread of the infection. Clinically, endodontic cellulitis is called flare-up, and it happens during excess opening because of the environmental change of the oxygen level in the root canal, which enhances the action of regulative bacteria, and during instrumentation and obturation when debris or obturation material exude the apical foramen. Bacterial culturing in endodontics. There are 3 reasons for culturing root canal contents. Number 1. to determine the biological status of the root canal. Number 2, to assess the efficiency of the debridement procedure. Number 3, to isolate microbial flora for antibiotic sensitivity and resistant profiles in the cases of persistent infection. Intracanal medications. The main use of intracanal medication is to help destroy microbes. Number 1, phenol. It is effective medicament in the root canal. Number 2, conferrated phenol. It is a phenol that you find in camphor. It is a less toxic of the phenolic compound. Number 3, conferrated monochlorophenol, CMCP. It is a more toxic than the phenol, but it is also more active antiseptic but does not last for more than 3 days. It is less irritating than the triisoformalin. Number 4, triisoformalin. The compound is a mixture of 3 isomers. It has a powerful antibacterial action that lasts for up to 7 days. Number 5, calcium hydroxide. This is biocompatible and can be used to disinfect the root canal for more than 1 week. The antimicrobial activity of the calcium hydroxide is related to hydroxyl ion in aqueous environment. The hydroxyl ion are highly oxidant free radical that slow extreme reactivity, reacting with several biomolecules. Number 6, photoactivated disinfection. It is a medical treatment that utilizes light to activate a photosynthesizing agent in the presence of oxygen. The exposure of photosynthesizer to the light results in the formation of oxygen species such as singlet oxygen and the free radical causing localized photo damage and cell death. Mechanism. The photo-activated disinfection involves a 3-component: light, photosensitizer, and oxygen. The photosensitizer is administered to the root canal, but upon irradiation with a light of a specific wavelength, the photosensitizer undergoes a transition from the low energy ground state to the excited singlet state. Then the photosensitizer may decay back to its ground state with emission of fluorescence, or may undergo transition to the higher energy triplet state. The triplet state can react with endogenous oxygen to produce singlet oxygen and other radicular species, causing a rapid and selective destruction of the target tissue. Antibiotics in endodontics. Antibiotics are used when the infection spreads to alveolar bone with a swelling of the area above the aqueous tooth, and the drainage does not relieve the swelling. Most of the bacterial species involved with endodontic infections are susceptible to penicillin, which make them first-line drugs of choice. In more serious cases, including life-threatening conditions, combining amoxicillin with a glavulanic acid or metronidazole can achieve optimal antibacterial effects as a result of extending the spectrum of the action to include penicillin-resistant strains Erythromycin is used in the cases of penicillin allergy. As a conclusion, unnecessary use of antibiotics increases the risk for developing a resistant species of the bacteria. Thank you for your nice listening.